neurology, physiology and anatomy, muscles and mastication. All right, so for the muscles and mastication, I received relatively probably around like 10 questions on this, which is way more than I was expecting, but I don't think it's like too high yield, so you don't have to worry too much about it. But what you need to know is that all of the muscles of mastication are going to be innervated by the mandibular branch of the trigeminal nerve. So cranial nerve V3 or 5-3, right? And if you ever are if you're ever confused about what you should put for innervation for the muscles of mastication, just place CNV3, cranial nerve V3. That will be your best bet of getting it right because majority of them are going to be innervated by cranial nerve V3. So there's the pterygoid muscle, which protrudes the jaw, okay? And it's also innervated by cranial nerve V3. And then you have the lateral pterygoids, okay? And those are the only muscles that depress the jaw, all right? And that's something that they like to ask a lot about because it's one of the only muscles in the body that will depress the jaw is the lateral pterygoid, all right? So keep that in the back of your mind, as well as the pterygoid protruding the jaw. They like to talk about the pathology of TMJ. And so TMJ is just essentially like when you're just grinding your teeth a lot and gripping your jaw. And so it involves the masseters and the pterygoids. And you can get like referred pain to the ear. And so that pain, that TMJ pain that's in the ear is from cranial nerve V3. Once again, your cranial nerve V3, mandibular branch of the trigeminal nerve, is going to be causing that pain in the ear from TMJ. So anything involving the jaw, if they ask you what nerve, your best bet is going to be cranial nerve V3, the trigeminal nerve mandibular branch. Other than that, you have a lateral or the lowest yield thing that you can think of. But I remember getting a question on it that somewhat involves the mouth and like the jaw. There's this thing known as the inferior alveolar nerve that gives sensation to the lower teeth. And then you also have the mental nerve, okay? The mental nerve comes off of the alveolar nerve, and the mental nerve provides lower lip sensation, okay? Those are relatively lower yield topics. Just remember the pterygoids, TMJ, and your cranial nerve V3 for a majority of your muscles in the masseter.